101. What is the best way to dispose of contaminated dressings? A. Throw them in the regular trash. B. Place them in a biohazard bag. C. Leave them on the bed. D. Flush them down the toilet. Answer. Place them in a biohazard bag. Rationale. Biohazard bags contain infectious waste safely per infection control standards. Option B is correct. Options A, C, and D risk contamination or improper disposal. 102. Which legal principle should a nurse follow when witnessing a consent? A. Sign without patient explanation. B. Ensure the patient understands the procedure. C. Let family sign instead. D. Skip witnessing if busy. Answer. Ensure the patient understands the procedure. Rationale. Witnessing consent requires verifying patient comprehension, a legal duty. Option B is correct. Options A, C, and D violate informed consent principles. 103. How should a nurse position a patient with a head injury to reduce ICP? A. Flat with head elevated 30 degrees. B. Fully flat on their back. C. Prone with head down. D. Sitting upright at 90 degrees. Answer. Flat with head elevated 30 degrees. Rationale. 30-degree elevation reduces intracranial pressure by aiding venous drainage. Option A is best. Options B and C increase ICP. Option D may be too extreme. 104. What should a nurse do first if a patient's call light isn't working? A. Ignore it and check later. B. Assess the patient's immediate needs. C. Fix the light before anything. D. Tell them to yell for help. Answer. Assess the patient's immediate needs. Rationale. Patient safety comes first. Assessing needs ensures urgent issues are addressed. Option B is priority. Options A and D neglect care. Option C delays patient focus. 105. Which precaution is needed for a patient with influenza? A. Contact precautions only. B. Droplet precautions. C. Airborne precautions. D. Standard precautions only. Answer. Droplet precautions. Rationale. Influenza spreads via droplets. Masks and distance are required. Option B is correct. Option A misses droplet spread. Option C is for airborne. Option D isn't enough. 106. What should a nurse check before assisting with a bedpan? A. Patient's ability to assist and privacy. B. Room temperature only. C. Time since last meal. D. Bed height preference. Answer. Patient's ability to assist and privacy. Rationale. Checking ability ensures safe positioning, and privacy respects dignity. Option A is key. Options B, C, and D are secondary or unrelated to the task. 107. How should a nurse respond to a patient asking about dietary restrictions? A. Say it's not their concern. B. Explain the purpose of the diet simply. C. Tell them to ask the doctor. D. Give a complex medical reason. Answer. Explain the purpose of the diet simply. Rationale. Simple explanations educate and empower patients within the nurse's scope. Option B is best. Option A dismisses. Option C delays. Option D may confuse. 108. What should a nurse teach a patient to prevent skin breakdown? A. Stay wet after bathing. B. Keep skin clean and dry. Apply lotion. C. Avoid turning in bed. D. Use harsh soaps daily. Answer. Keep skin clean and dry. Apply lotion. Rationale. Clean, dry, moisturized skin prevents breakdown. Option B is correct. Options A, C, and D increase risk via moisture, pressure, or irritation. 109. Which action ensures safety when adjusting a patient's pump? A. Set the rate without checking orders. B. Verify the rate against the order first. C. Leave it running unattended. D. Ask the patient to adjust it. Answer. Verify the rate against the order first. Rationale. Verifying ensures the correct rate, preventing over or underinfusion. Option B is standard. Options A, C, and D risk errors or neglect safety protocols. 110. What should a nurse include in a patient's preoperative teaching? A. Procedure steps and what to expect. B. Hospital billing process only. C. Staff schedules. D. Post-op visiting hours only. Answer: procedure steps and what to expect. Rationale: teaching about the procedure and expectations reduces anxiety and prepares the patient. Option A is essential. Options B, C, and D are unrelated to pre-op needs. 111. What should a nurse do first if a patient's incision begins bleeding? A. Apply pressure to the site. B. Assess the amount and type of bleeding. C. Change the dressing quickly. D. Call the surgeon immediately. Answer: assess the amount and type of bleeding. Rationale: assessing first determines the severity and type, e.g., arterial, guiding action. Option B is priority. Option A follows. Option C may disrupt assessment. Option D comes after initial steps. 112. Which step prevents infection when handling a central line dressing? A. Use clean gloves only. B. Wear sterile gloves and mask. C. Touch the site with bare hands. D. Change it without hand washing. Answer: wear sterile gloves and mask. Rationale: sterile gloves and a mask maintain a sterile field, preventing central line infections. Option B is correct. Options A, C, and D increase contamination risk. 113. How should a nurse respond to a patient refusing pain medication? A. Force the patient to take it. B. Ask why and offer alternatives. C. Tell them they'll regret it. D. Ignore their refusal entirely. Answer: ask why and offer alternatives. Rationale: asking respects autonomy and identifies concerns, allowing tailored care. Option B is best. Option A violates rights. Options C and D dismiss patient needs. 114. What is the safest way to transport a patient with a spinal injury? A. Walk them with support. B. Use a backboard and cervical collar. C. Sit them upright in a chair. D. Carry them in arms. Answer: use a backboard and cervical collar. Rationale: a backboard and collar stabilize the spine, preventing further injury. Option B is safest. Options A, C, and D risk spinal damage. 115. Which vital sign should a nurse monitor closely in a dehydrated patient? A. Temperature. B. Pulse rate. C. Blood pressure. D. Respiratory rate. Answer: pulse rate. Rationale: dehydration increases pulse, tachycardia, as the heart compensates for low volume, a key sign. Option B is priority. Options A, C, and D change later or less directly. 116. What should a nurse do to protect patient privacy during a phone call? A. Discuss care in a private area. B. Speak loudly near the desk. C. Share details with anyone asking. D. Leave the chart open nearby. Answer: discuss care in a private area. Rationale: a private area prevents overhearing, upholding confidentiality per HIPAA. Option A is correct. Options B, C, and D expose info unnecessarily. 117. How should a nurse assist a patient with oral care who has dentures? A. Brush them with toothpaste in the mouth. B. Remove and clean them separately. C. Soak them in water indefinitely. D. Leave them out during care. Answer: remove and clean them separately. Rationale: removing and cleaning dentures ensures hygiene and prevents aspiration. Option B is best. Options A and C are improper. Option D neglects cleaning. 118. What should a nurse teach a patient to reduce fall risk at home? A. Keep floors cluttered for comfort. B. Install grab bars and remove rugs. C. Walk barefoot always. D. Use dim lighting at night. Answer: install grab bars and remove rugs. Rationale: grab bars aid support, and removing rugs prevents tripping, reducing falls. Option B is effective. Options A, C, and D increase fall risk. 119. Which action ensures the right route during medication administration? A. Give oral meds for a faster. B. Verify the route matches the order. C. Assume the route based on form. D. Skip checking if time is short. Answer. Verify the route matches the order. Rationale. Verifying the route, e.g., oral, 4, against the order prevents errors per the rights. Option B is correct. Options A, C, and D risk harm or mistakes. 120. What should a nurse assess in a patient with a new colostomy? A. Stoma color and output. B. Patient's clothing size. C. Room air quality. D. Time since last visitor. Answer. Stoma color and output. Rationale. Stoma color, pink/red, and output assess function and health. Option A is critical. Options B, C, and D are unrelated to colostomy care. 121. What is the best way to prevent needle stick injuries after an injection? A. Recap the needle carefully. B. Dispose of it in a sharps container. C. Leave it on the tray. D. Bend it with a tool first. Answer. Dispose of it in a sharps container. Rationale. Immediate sharps disposal prevents accidental sticks, per safety standards. Option B is correct. Options A, C, and D increase injury risk. 122. Which ethical principle guides a nurse when a patient asks for truth? A. Beneficence. B. Veracity. C. Justice. D. Fidelity. Answer. Veracity. Rationale. Veracity, truthfulness, ensures honest communication, respecting patient rights. Option B is correct. Options A, C, and D focus on doing good, fairness, or promises, not truth directly. 123. How should a nurse position a patient with a fractured femur? A. Legs straight and flat. B. Affected leg supported with pillows. C. Sitting fully upright. D. Prone with legs extended. Answer. Affected leg supported with pillows. Rationale. Supporting the leg reduces pain and stabilizes the fracture. Option B is best. Options A, C, and D increase discomfort or risk movement. 124. What should a nurse do first if a patient's telemetry alarm sounds? A. Silence the alarm quickly. B. Check the patient's condition. C. Reset the monitor settings. D. Call the technician. Answer. Check the patient's condition. Rationale. Assessing the patient first ensures safety and identifies the alarm's cause, e.g., arrhythmia. Option B is priority. Options A, C, and D delay critical response. 125. Which precaution is needed for a patient with a MRSA wound infection? A. Droplet precautions. B. Contact precautions. C. Airborne precautions. D. Standard precautions only. Answer. Contact precautions. Rationale. MRSA spreads via contact. Gloves and gowns prevent transmission. Option B is correct. Options A and C are for other modes. Option D is insufficient. 126. What should a nurse assess before administering a PRN pain medication? A. Pain level and last dose time. B. Patient's meal schedule. C. Room noise level. D. Family presence. Answer. Pain level and last dose time. Rationale. Assessing pain and timing ensures need and safety, e.g., avoiding overdose. Option A is key. Options B, C, and D are unrelated to PRN administration. 127. How should a nurse respond to a patient asking about organ donation? A. Say it's too complex to explain. B. Provide basic info and resources. C. Tell them it's not allowed. D. Direct them to family only. Answer. Provide basic info and resources. Rationale. Offering info and resources educates and supports patient choice within scope. Option B is best. Options A, C, and D avoid responsibility or mislead. 128. What should a nurse teach a patient to improve wound healing? A. Keep the wound dry and uncovered. B. Eat a diet high in protein and vitamins. C. Avoid cleaning the wound. D. Apply heat constantly. Answer. Eat a diet high in protein and vitamins. Rationale. Protein and vitamins, e.g., C, zinc, aid tissue repair and healing. Option B is correct. Options A, C, and D delay healing or risk infection. 129. Which action ensures safety when using a wheelchair for a patient? A. Leave brakes off for quick moves. B. Lock brakes before transfer. C. Push it without checking wheels. D. Let the patient steer alone. Answer. Lock brakes before transfer. Rationale. Locking brakes prevents movement, ensuring safe transfer. Option B is standard. Options A, C, and D increase fall or injury risk. 130. What should a nurse include in a patient's post-op care plan? A. Pain management and mobility goals. B. Hospital visiting policies only. C. Staff break times. D. Patient's TV preferences. Answer. Pain management and mobility goals. Rationale. Pain control and mobility are key post-op priorities for recovery. Option A is essential. Options B, C, and D are unrelated to clinical care planning. 131. What should a nurse do first if a patient reports sudden shortness of breath? A. Increase room ventilation. B. Assess respiratory status and oxygen saturation. C. Give oxygen without an order. D. Call the respiratory therapist. Answer. Assess respiratory status and oxygen saturation. Rationale. Assessing breathing and O2 levels first identifies the urgency and guides intervention. Option B is priority. Options A and C act without data. Option D delays assessment. 132. Which action prevents infection when caring for a patient with an open wound? A. Use clean gloves only. B. Apply sterile dressings with sterile technique. C. Touch the wound with bare hands. D. Reuse dressings to save supplies. Answer. Apply sterile dressings with sterile technique. Rationale. Sterile technique and dressings prevent contamination of open wounds. Option B is correct. Options A, C, and D increase infection risk. 133. How should a nurse respond to a patient asking about a lab result delay? A. Say it's the lab's fault. B. Explain possible reasons and reassure them. C. Tell them to stop asking. D. Ignore the question entirely. Answer. Explain possible reasons and reassure them. Rationale. Explaining and reassuring builds trust and addresses concerns professionally. Option B is best. Options A, C, and D dismiss or deflect patient needs. 134. What is the safest way to help a patient stand from a seated position? A. Pull them up by the arms. B. Use a gait belt and assist slowly. C. Tell them to stand alone. D. Lift them fully off the chair. Answer. Use a gait belt and assist slowly. Rationale. A gait belt and slow assistance ensure stability and safety for both patient and nurse. Option B is correct. Options A, C, and D risk injury or falls. 135. Which vital signs should a nurse prioritize in a patient with heat stroke? A. Blood pressure. B. Temperature. C. Pulse rate. D. Respiratory rate. Answer. Temperature. Rationale. Heat stroke causes hyperthermia. Monitoring temperature is critical to assess severity and cooling needs. Option B is key. Options A, C, and D are secondary here. 136. What should a nurse do to ensure privacy during a patient examination? A. Keep the door open for safety. B. Close the door and use a curtain. C. Allow visitors to stay and watch. D. Discuss findings aloud nearby. Answer. Close the door and use a curtain. Rationale. Closing off the space protects privacy and dignity during exams. Option B is correct. Options A, C, and D expose the patient unnecessarily. 137. How should a nurse assist a patient with a bed bath who is bedridden? A. Wash only the face and hands. B. Use warm water and wash systematically. C. Skip soap to save time. D. Bathe them fully clothed. Answer. Use warm water and wash systematically. Rationale. Warm water and a head-to-toe approach ensure thorough hygiene and comfort. Option B is best. Options A and C are incomplete. Option D is impractical. 138. What should a nurse teach a patient to manage high blood pressure? A. Increase salt in the diet. B. Reduce stress and limit sodium. C. Avoid all physical activity. D. Drink less water daily. Answer. Reduce stress and limit sodium. Rationale. Stress reduction and low sodium help control BP effectively. Option B is correct. Options A and D worsen it. Option C is too extreme and counterproductive. 139. Which action ensures the right dose is given during med administration? A. Estimate the dose if unclear. B. Check the order and measure exactly. C. Give half to be safe. D. Skip it if unsure of amount. Answer. Check the order and measure exactly. Rationale. Verifying and measuring the exact dose per order prevents errors per the rights. Option B is correct. Options A, C, and D risk under or overdosing. 140. What should a nurse assess in a patient with a new PICC line? A. Site redness and arm swelling. B. Patient's preferred arm position. C. Time of last bath. D. Room humidity level. Answer. Site redness and arm swelling. Rationale. Redness and swelling may indicate infection or complications with the PICC line. Option A is critical. Options B, C, and D are unrelated to PICC assessment. 141. What is the best way to clean reusable equipment after patient use? A. Wipe with a dry cloth only. B. Disinfect with an approved solution. C. Rinse with cold water. D. Leave it for the next shift. Answer. Disinfect with an approved solution. Rationale. Disinfection kills germs on equipment, preventing spread per infection control. Option B is correct. Options A and C are inadequate. Option D delays safety. 142. Which legal duty should a nurse fulfill when a patient signs a consent? A. Ensure they sign without questions. B. Verify they understand risks and benefits. C. Sign for them if they hesitate. D. Skip consent for minor procedures. Answer. Verify they understand risks and benefits. Rationale. Nurses ensure informed consent by confirming comprehension, a legal duty. Option B is correct. Options A, C, and D violate consent principles. 143. How should a nurse position a patient with a chest tube after surgery? A. Flat on their back. B. Semi-Fowlers on the unaffected side. C. Prone with chest elevated. D. Fully upright at 90 degrees. Answer. Semi-Fowlers on the unaffected side. Rationale. Semi-Fowlers aids drainage and breathing. The unaffected side avoids tube pressure. Option B is best. Options A, C, and D impair function or comfort. 144. What should a nurse do first if a patient's NG tube stops draining? A. Flush it with saline. B. Check tube placement and patency. C. Remove it immediately. D. Notify the physician. Answer. Check tube placement and patency. Rationale. Checking ensures the tube is in place and unblocked before acting. Option B is first. Options A and C need verification. Option D follows assessment. 145. Which precaution is needed for a patient with hepatitis A? A. Airborne precautions. B. Standard precautions with enteric care. C. Droplet precautions only. D. Contact precautions only. Answer. Standard precautions with enteric care. Rationale. Hepatitis A spreads via fecal-oral route. Gloves and hand washing, enteric, suffice with standard precautions. Option B is correct. Options A, C, and D mismatch transmission. 146. What should a nurse assess before helping a patient with toileting? A. Mobility and bathroom safety needs. B. Patient's favorite soap. C. Time since last meal. D. Bedside table arrangement. Answer. Mobility and bathroom safety needs. Rationale. Assessing mobility and safety ensures a secure toileting process. Option A is key. Options B, C, and D are unrelated to the task's priority. 147. How should a nurse respond to a patient asking about their prognosis? A. Say it's not the nurse's role. B. Offer general info and refer to the doctor. C. Give a detailed prediction. D. Tell them not to worry. Answer. Offer general info and refer to the doctor. Rationale. Nurses provide basic info within scope and defer specifics to physicians. Option B is best. Option A avoids duty. Option C oversteps. Option D dismisses concerns. 148. What should a nurse teach a patient to prevent postoperative pneumonia? A. Avoid deep breathing exercises. B. Use an incentive spirometer regularly. C. Stay in bed without moving. D. Cough only when it hurts. Answer. Use an incentive spirometer regularly. Rationale. Spirometry expands lungs, preventing atelectasis and pneumonia post-op. Option B is correct. Options A, C, and D increase risk by limiting lung function. 149. Which action ensures safety when setting up a sterile field? A. Open packages away from the field. B. Reach over the field to place items. C. Use clean gloves only. D. Set it up on a wet surface. Answer. Open packages away from the field. Rationale. Opening away prevents contamination of the sterile field. Option A is correct. Options B, C, and D compromise sterility. 150. What should a nurse include in a patient's handoff report at shift change? A. Recent vitals and new orders. B. Patient's personal hobbies only. C. Gossip about staff. D. Room decoration details. Answer. Recent vitals and new orders. Rationale. Vitals and orders ensure continuity of care in a handoff. Option A is essential. Options B, C, and D are irrelevant or unprofessional.